Welcome to the Clinical Corner. I'm Dr. JJ Thomas. Today we're going to go over some positions for sleep. If you have difficulty sleeping because of especially hip pain or back pain, I'm going to give you some positions that might actually help you in the short term, and we'll talk about some shoulder positions as well if your problem that limits you with sleep is shoulder positions. So for the hip and low back, if you're a side sleeper, one thing that you can do is make sure, number one, I guess we should talk about neck too. If you're sleeping on your side, this is for next, make sure that your head is in relatively neutral position. So make sure the pillow doesn't have you like way up here. Make sure the pillow doesn't have you way like this, okay, for your neck. For your low back, a lot of people are really tight in their hips and that affects their low back. So what you can do is put a pillow between your knees, and then that puts your hip in a nice alignment that doesn't overstretch the hip or the low back past its capacity at night. So just like this, for the neck and the hips. If you have a shoulder issue, you can take that pillow and you can place it in front of you so that your shoulder is kind of out at an angle rather than down like this. The rotator cuff doesn't have a great blood supply. Part of it, the supraspinatus, the one muscle. So that's the one that most people have impingement problems on. So when the rotator cuff doesn't get good blood supply at night, it starts to get real achy and bothersome. So if you just open it up a little bit by putting a pillow in front of you, like I said, kind of like this, that puts the angle a little bit more open to allow blood flow for your shoulder at night. So those are 3 side sleeping options that can help keep you out of trouble. If you're a belly sleeper, that's hard on the whole body, honestly. Belly sleeping is one of the hardest positions to keep you out of trouble, especially with degenerative changes that happen as we age. But a couple options you can do as well are for the low back. If you're a belly sleeper in the low back, what happens oftentimes, most of our weight is in our central region. So if you're on your stomach, you're going to essentially end up extending your low back all through the night, which closes down your spinal segments and makes it really uncomfortable and, again, limits blood flow. So an option you can do if you're a belly sleeper is to now take a pillow and put it under your belly between your kind of chest and your pelvis so that your hips drop like this. Now don't make the mistake of putting it under hips so that now, see how my back is more arched? That would be a bad thing. So you want the pillow high enough that my butt, my tailbone kind of rounds down, and that opens up those lumbar spine segments. Now, if you are a belly sleeper, it's hard on the shoulder to have it up like this all night. So another thing that you should consider is maybe having an additional pillow that you hug like this. And that again will keep that open packed shoulder position to allow blood flow to the rotator cuff during the evening. So those are 2 options for if you are either a side sleeper or a belly sleeper and have problems in either neck, spine, hips, or shoulders. So options to just keep those joints getting as much blood flow as possible throughout the evening. Now, if you do have those issues, don't stop here though, because it is a sign that you're probably limited in range of motion. And that's why you become uncomfortable at night as your body is in one position and doesn't have good blood supply. So what that should tell you is that you do need to do something to get better range of motion, to get better blood flow to your extremity or spine, wherever your problems are. And to do that, we'll do some follow-up clinical corners to talk about ways to bring better blood flow to those areas. So just like and subscribe so you don't miss those when they come out. And if there's anything else specific you want to request, please, by all means, reach out. I'd love to hear from you. Till next time.